Welcome everyone to Something to Talk About from the Bainbridge Island Senior Community Center, sponsored by Fieldstone Memory Care Bainbridge Island. Fieldstone offers innovative and compassionate care, now accepting residents. They also offer day stay and respite programs. Call 360-689-4314 to schedule a tour of Fieldstone's beautifully appointed apartments on Rolling Bay today. I'd also like to acknowledge that the Senior Community Center is on the ancestral homeland of the Coast Salish people, specifically the Suquamish people, the people of the clear salt water. We honor them. All right, thank you everyone again for joining us. I'm very happy to have folks with us. And I'm very happy to introduce today Nadine Zyga.
Zigai. Yeah, you're close. That was good. Zigai.
Thank you, Zigai. Thank you. Who is with Carina Care. And Nadine is going to be talking to us about what is Carina Care, how does it work, how can it benefit us. So I'm going to go ahead and turn the mic over. Nadine, thank you so much for joining us today.
Hi, thank you so much for having me. It's nice to see you all. And thank you for letting me share Carina with you at your meeting today. So I'm going to go ahead and share my screen now. And I have a really short slide presentation. Carina.org is an easy to use website where care professionals can meet with individuals seeking home care and child care. So today we're going to go over, of course, the importance of home care. I'll give you an introduction to Carina, Carina's home care matching services, and then opportunities for collaboration. And of course, we all know home care is important because it allows for an individual to age in place, and if they're in an environment that they're familiar with. This, of course, can reduce falls, maintain poise and dignity. It promotes a nurturing relationship with a caregiver. And it also allows for the family and individual to work on their care plan together with their caregiver. And as you can see by the slide, the projected growth of the Washington population as of 2012 over the next, 38 years from now until 2060 is going to increase by almost 350% with the 85 and older population. So our need for home care is definitely going to steadily increase over those next 38 years. This is Jacqueline C. She's one of our home care providers through one of our home care agencies. And her quote resonated with me. She says, "My favorite moment in caregiving is to get close to the people who need me and to give the help they need from me. Without Carina, you didn't know anything. You had to go to their houses and do a preview interview, and you had to get to know them with you in their house. And with Carina, you already know a little bit about them." So this resonated with me because I am an individual provider. I'm registered with the state and received my 72 hours of training about 7 years ago. And I did that for my sister-in-law who has ALS. So she is in a wheelchair and she's semi-mobile. Hold on one second. I do have kids here who are knocking on my door. Is it an emergency? Okay. Forgot what time it was. That's okay though. They probably thought they could sneak in under the wire. So Jacqueline's quote really resonated with me because being an individual provider for my sister-in-law, I know that my sister-in-law was extremely anxious about having someone come into her home that she didn't know to help care for her. Her husband, my brother-in-law, had been doing that for quite some years, but he had to go back to work part-time to support them. So I volunteered to just come and take over for him. Of course, they said, no, you can't do that. You know, you have kids at home and you work part-time. We wouldn't want you to give up all that time. So I found that I could become an individual provider through the state of Washington. They said, that's a great compromise. So I went for the training, and for a year and a half, I went to my sister's house 4 or 5 days a week, part-time, and I did grocery shopping for her, house cleaning. I helped her with washing her hair, dyeing her hair, cutting her hair for her, all of these daily living skills that she could no longer do on her own. I made meals for them in advance and froze them for them. And, you know, just helped sometimes driving her to doctor appointments. So that prepared her for when they needed full-time care, and I could no longer do that once her husband was back to work full-time. The process, though, of finding another individual provider took a little bit of time to find someone she was comfortable with and connected with. And I think now if they had to find someone, they would probably use Carina, because for her way of communication, because she can't speak as well with her ALS, is through the computer and through texting. So this would be an excellent way for her to connect with an individual provider and find out if they already have some kind of, connection online before they meet in person. So I think Carina, in that sense, would be great for them. So a little bit about Carina. We are a not-for-profit that believes communities are stronger when people, regardless of income, can easily and safely access quality care. We connect home care seekers with potential in-home caregivers so they can safely receive routine, ongoing care in their home, and that enhances their ability to age in place. Providers on Carina can help people with daily living activities such as personal hygiene, dressing, transfers, toileting, laundry, shopping, meal prep, eating, cleaning, and managing medication. Home care professionals on Carina are all background checked, trained, and they receive good benefits and union wages. So we have two different offerings on our website. One is the Carina's home care offering of individual providers, or IPs. So this is for consumers who are eligible for Medicaid in-home care, and they want to interview and direct a caregiver themselves. This is eligible to all Medicaid consumers throughout every county in Washington. Our second option is agency providers. So home care agency providers, or APs, can help consumers who are residents of King County, are either eligible for Medicaid in-home care or pay for care out of pocket with subsidies, and they are looking for an agency to help find and direct their care. So now I'm going to take you through a little brief walkthrough of what using our service online looks like. It's very easy, and we're going to start with the individual providers. So again, an individual provider or an IP on Carina is when you choose your care provider while working with your case manager. You've already had a certain amount of hours that will be allotted to you for your IP. You get access to a vetted pool of active, skilled, state certified workers, and they're located in every county across Washington. And you can browse and choose your care provider and find the person that has the right qualifications and that you connect with. So when you go to carina.org, you're going to see our homepage, and you'll go to the top left-hand corner, you find care. Then you're going to you'll select using Medicaid funding as your option on the next screen. This will take you to the page where you can select join for free. Here you're going to start your registration process on Carina. You'll enter your state, your name, then you'll verify your Medicaid status. So again, you will enter your last 4 digits of your social security number and your date of birth. After you've entered that information and you're verified, you'll start onboarding to Carina, and you can start looking for home care. Once you choose this tab, they're going to take you to a page with all of the providers that are located near you. Here you're going to find information as to what the hours they have that are available during the week, the days of the week that they're available, the languages that they speak, and their skills and preferences. Once you find someone that seems like a good fit for you, you can then message them directly and they'll get back to you, and you can start that conversation as to, when you might meet, or if you might want to talk on the phone first to get to know that person. So this is our individual provider process on Carina. Now, the second offering, and this is the agency providers. This is not available outside of King County at the moment, but that is, of course, one of our long-term goals for Carina. But if you're looking for an AP, you're a King County resident who's eligible for Medicaid in-home care, or can pay for care out of pocket with subsidies, and you want a home care agency to find and direct your caregiver, you can search for home care agencies with available providers near you. This is funded through the King County Department of Community and Human Services, DCHS. So the second offering is you're going to find, again, at carina.org, you're going to find home care. And on the next page, you're going to be paying for care outside of Medicaid. Once you've selected this option, you'll then enter your zip code. This will take you to the agency providers that are available near you. Again, you'll see that the agencies list all of the languages that their agency providers have and their expertise and skills that they offer and what their hourly rates are. Once you've chosen a home care agency, on the next page, you can message that home care agency with more specific details as to what your care plan looks like and the kind of provider that you're looking for. After you've submitted this information, you'll receive a confirmation and next steps. So of course, there's going to be people that fall in between being eligible for Medicaid and hours for an individual provider and the individual who can afford their out-of-pocket and plus subsidies to pay for their provider from an agency. So we do have some other resources, and this in particular, I think, is probably geared more towards the island volunteer caregivers. And that is, if anyone's interested in becoming an IP like I did, it can be a family member, a neighbor, a volunteer that wants to do paid work with Medicaid consumers. So if someone's interested in becoming an IP, they can contact Consumer Direct Network Washington, also known as CDWA, to become an individual provider and use Carina to match with someone who needs care near you. Once you're an individual provider, I have a number. So I can offer that number to someone that would be seeking in-home care. So once you are that IP, if you know someone that is a neighbor or if you're a volunteer at an organization, you could find someone and you could offer them your IP number so that they could locate you and have you come and be their caregiver. So Consumer Direct Care Network Washington, also known as CDWA, became the employer of all IPs in Washington this June of 2022. So you probably already meet the requirements to become an IP. You must be 18 years or older, pass a background check, do not require sponsorship, are eligible to work in the US, and you've met all the training requirements. And if you'd like to be someone who can drive to doctor appointments or any other appointments someone might have, you do have to have a valid driver's license and auto insurance. So if you want to find out more about how you can become an IP, you can go to www.consumerdirectwa.com. And there's also two other supports that we have for families and individuals. That's TSOA and MAC. They're both Medicaid programs that provide free services to unpaid caregivers who are taking care of family members who are at least 55 years and older. So with the Tailored Supports for Adults, TSOA, this provides service to support unpaid caregivers in Washington who are providing care to people ages 55 and older who are not eligible for Medicaid or are eligible for limited services. And this provides a small personal care benefit for people who do not have a family or caregiver to help them. So MAC, Medicaid Alternative Care, this provides support services and respite for family caregivers of recipients age 55 and older who reside at home and are on categorically needy or alternative benefit plans. This service can only be provided in a home setting. And if you want to find out more about TSOA and MAC, you can go to www.washingtonlawhelp.org. Okay, so of course, Carina's always looking for opportunities for collaboration, and we'd like to increase access to in-home care for older adults and people with disabilities, and continue to share out information about our home care offering. So please let us know if you have suggestions for how we can work with your organization. If you're interested in sharing out information about Carina on your website, newsletter, or social media. If you'd like Carina to amplify your organization's messaging on your social media platform, or if you'd like Carina to present our free online matching service to your organization staff or members. This is just an example of what our newsletter content looks like that we share out with organizations. And you can always, of course, contact myself, Nadine Zegai. I'm the outreach coordinator at Carina. Or you can also contact Chrisetta Sloat. She's the manager of our home care project management, and she has joined us during this meeting. And we're always happy to answer any questions that you might think of after this presentation, or if you have any ideas for collaboration. You can always find us at carina.org, Facebook, YouTube, or Instagram. Okay, I don't know, I don't see that anyone putting questions, but if you have any questions at this time, I'd be happy to answer them.
Thank you so much, Nadine. That was really helpful. And I'm just so glad to have this information to share with our members and community. Any questions for Nadine?
I have a question. This is Bill Woods.
Yes, welcome, Bill. Go right ahead.
Thank you. Nadine, can you give us some information about cost to individuals who would go through Carina to get a home health care person?
Well, if you're going through Medicaid and you've already been approved for hours through Medicaid, there's no cost. So that is state funded. And that would be, at this moment, the only option for people in Kitsap County. So here on Bainbridge and Paulsbo. If you're in King County, we right now offer that option that you can pay out of pocket or with subsidies. And as you saw, I think on the slide, it showed that when you get to the point of finding an agency, they do list on there what their hourlies are. And some of those examples were like $30, $32 an hour. So that's the cost before, before your insurance is a subsidy that's helping out with that. And so that's just gonna depend on each individual's insurance and what they're using as a subsidy to pay for that care provider.
Did you say that you cannot use Carina if you live in Kitsap County?
You can only use the option for the individual providers, and you're using your Medicaid with approved hours through Medicaid. That's correct.
Thank you.
So, but I would say, and we have found with some other organizations that within communities, once they realize that you can have your friends, families, and neighbors or volunteers become IPs, that's been a really great way for communities to kind of support one another. It's a great way to find jobs for people within the community. And you're familiar with those people already, which is always really great.
Yes, thank you for your question, Bill. That was excellent. Reed, I see you've got your hand up.
Yes, I'm wondering about folks who are maybe looking at helping their family members who have worked through DSHS directly in the past. Does that sound like a familiar situation to you?
So people that have already been an individual provider, are you saying?
They have set up themselves, that they are a family member, say, of somebody who needs care, and they have applied and gone through training to help their family member, and they get some compensation for that from the state. Does Carina's program just basically make that easier for them to set up, or is it a different program altogether?
Well, No, I mean, the easy part about Carina is once you have become an individual provider, you can go through Carina to find people seeking care. And if you already know of someone, though, in your area or a friend, family member that you're going to be an individual provider for, you can just directly give them your IP number and they can register for their home care with your IP number. And so that IP number stays with you for life. Like right now, I'm not working as an individual provider for my sister-in-law anymore, but at any time I could reactivate online, because you have to do it every so few years. You have to go back in and get credentialed online. But I will always have my independent provider number that I can either share out with other people that want me to come into their home to care for them, or I could go onto Carina and I could register with Carina to do work for anyone in my community that would match with me online.
So that number is a state provided number?
Yes, your IP number is your number as long as you're an independent provider. Yeah. But you only get that once you've gone through 72 hours of training. And you can do that over a period of time. I did mine in like 3 weekends. I just got through it. But there's all different ways that you can set up going through training.
Yes, yeah. And I know that there are, this area is kind of complex because there are people who, without any background training, have started to help people. And so there's sort of this shadow market of people who provide care. And then you have highly organized agencies that have overhead costs that make the prices vary quite a bit. And it's really a buyer beware sort of situation, which is frustrating for families that don't, as many of us don't, have a lot of experience before we need the services. With how the system, I put that in quotation marks, is set up. And it sounds like you're trying at Carina to at least provide some focus around people who qualify for Medicaid support.
Yeah, I mean, and we really just added this to our presentation recently because we found, like what you're saying, that there are a lot of people in communities that don't have family or close friends that can step in to take care of them, but there are a lot of volunteers like at your organization or family that come to you asking for resources. If they don't qualify for this or qualify for that, maybe someone in the family would be interested in becoming an individual provider or a neighbor. And they're already doing some of these things anyway, but now this could actually become what they're paid to do. So they have more time than free if they're not working another job to take care of someone, or maybe even become an individual provider for somebody else, if they really love the work that they're doing.
We did a quick scan. Hi, I'm Cressida. Sorry for joining late. I just wanted to add that we did a quick scan of consumers who are Medicaid consumers searching for care on Bainbridge, and I think like maybe 2 individuals showed up. So if you were a Medicaid provider, you joined Carina, completely free matching service, you would be able to search and filter for consumers near you. You would be able to kind of put in, I'm looking for somebody, a 15-minute drive, 30-minute drive, and, all the different things that you're interested in, whether the different types of care you can provide. And you can search for consumer. And then if you found somebody, if one of those Bainbridge Island consumers looked interesting to you, you could reach out to them and message them inside the Carina app and engage in that back and forth, and ultimately meet and hopefully get approved to work for them.
I don't know if you can hear me, Katie, but I have a question about this.
Yes, we can hear you, Julie. Please go right ahead.
Great. I have a couple of questions, actually. When you first started the presentation, Nadine, you talked about sort of awareness and how information is not cold with the IPs. And I don't understand how an awareness or information about the client needs comes to the IP?
How the information or what their needs are. So
Yeah, they're
when
getting ready
you-
to knock on the door for the first time. And when you opened with your example of someone who's doing this work, you said it removes some of that
it
unfamiliarity.
removes a lot of the back and forth. So, you know, and some people might need help going online and filling out the information or getting through it. And so you can ask friends and family members to help, or volunteers at your local organization that you belong to. But when you go online and you get to the certain point after you've registered and put your information in your location, you know, your zip code, you have choices as to what you're specifically looking for. And when you read all of the different summaries of the different independent providers, you'll see all of their qualifications and their skills and the languages they speak that are listed underneath their name. And then when you go to message them, after you choose that individual provider, it'll take you to a page where you can actually send a personal message. There you can actually put in some of the other things that you might be looking for, as far as like housework or appointments that you have that are regular appointments that you need someone to drive you to. Are they available those times? Those are questions that you can ask in that message box. And then that individual provider will get back to you directly. So you can start a conversation with that person to see, one, you know, do your conversations flow together? Do you have a connection with them just in how you're speaking with one another and understanding one another? So that's what I was saying. It kind of takes out that person having to come to your home, because that's what would happen if you don't go through Carina and you just say, okay, I need an independent provider through a case manager with the state. Then they're going to send you somebody. You're going to have to see if there's like this connection between you, and there might not be. So then you'll go on to maybe the next individual provider. So Carina is kind of the middleman, I guess, so to speak, that takes that back and forth out, where you already have said, this is what I'm looking for. Can you do this? And then that person replies, and maybe you have a conversation about hobbies before you even meet, you know, like, what are your hobbies? Do we gel and what we both like, you know? So that's kind of where it makes it a little bit easier.
Okay, so I didn't know if you were, when you started talking, you were talking about your platform, because I've been using it for about 3 years. And I rarely get callbacks. In 3 years, I've had 2 callbacks.
Through Carina?
Mhm.
Yeah.
Yeah.
Okay.
It's really tough in our area.
It
And
is. Yeah.
that's part of the problem. And in
Yeah.
my particular case, I don't have access to family or friends who can easily step in and keep a schedule. So that certainly is one part of this. And sometimes it's a lot easier for a friend or family member to say, yeah, I can do a particular task and I'll do it in the future, grocery shopping, okay? But I can't schedule something. And I really am not interested in getting enrolled. So it's kind of an aspect of this. Another one is that one thing it does not tell the IP is, I'm looking for a broad sense of how to describe it, what people's behaviors are, or their energy level, which really influences other aspects of their health needs. And so I wondered what you had to say to this. I think you just changed the platform, and I think it's much better than it was.
Oh, good. Oh, that's great. Good.
But I have a question about that because I'm not getting responses. I note that there's not a place on the new platform for me providing a phone number.
You can put that in
Well, once
the
you start-
message. All right, you can put that in the message if you want the
So
provider to reach out to you.
Am I waiting for an email back or?
Well, do you use the internal messaging within Carina to, when you select somebody you want to work with, do you,
Right.
you email them inside of Carina?
Yeah.
Because you could say, you know, my name is Julie, I'm looking for, you know, this amount of help, or, you know, these days, please give me, you could add your phone number in the message that you then send them.
Okay, so it's personal choice because
Yes.
previously the platform had a spot where they said you can leave your phone number or you can choose not to.
Yeah, you know, we did just make this big move. And I am not sure if the phone number was for Carina to reach you via text or for the provider to reach you. So I think that, you know, safety and security is something we take really seriously. So I'll have to look into that. But to be sure, you would want to let the person you want to have further conversations with know that you are open to a phone call and provide the number.
Okay, well, I'm pretty sure that previously it asked for you as the provider seeker to leave your phone number if you chose to. Otherwise, you could just message. And so the other problem for folks who are looking for an independent provider and happen to live in the north end of the county here, because I suspect it's not just Bainbridge, that probably Paulsbo may have some of the same issues, is just finding people willing to come and make the trip.
That's the biggest problem we have. And, you know, just low supply is huge. And then the travel distances, you know, we've had to, I think we've made changes in our platform so that to count for ferry, you know, so it's not getting on the Seattle ferry, that it's not as simple as that. You know, I think that we've made changes to kind of have different modes of transportation. But yeah, so I will say big issue is supply. And then the second issue, we realize this, and we're always trying to work on this, is that, you know, we've heard that folks, let's say you're a care seeker, you reach out and you don't hear back. And we know that that's an issue, that kind of the ghosting or whatever you want to call it that happens on the platform. So, you know, what we do on our end for Carina is we have reminders to providers to keep their information up to date. If they're available, to say they're available. If they're not available, to say they're not available. We do as much as we can to keep the data fresh and as up to date in real time as possible. But there are, you know, limitations, many limitations. So I hear you on all of that.
Yeah, thank you, Julie.
And the training that you folks have talked about is not offered by you, it's offered by Medicaid of the state. Who is offering the training to the IPs?
Right, so the new employer of IPs is no longer, it's no longer DSHS, it's Consumer Direct Care Washington. So they have, they do some orientation, but the benefits, the SEIU 775 benefits group is still doing, they're still training. Carina, we're just a very simple, free online matching service.
And so DSHS is no longer doing the training either.
Yeah, DSHS, any training is provided by Consumer Direct Care Washington and by the benefits group. That's, you know, they've been doing that for a long time. They've had some, say, platform issues themselves, but it continues to be offered through them.
So I know this isn't directly what Carina Care does, but because obviously the lack of caregivers that are available. I mean, I know everywhere, and we're certainly experiencing it on Bainbridge. So for folks who may be interested about signing up to become an IP, could you just briefly kind of describe, I know Nadine, I think you said the 72 hours or 74 hours, just kind of give us a picture of what that might look like for someone.
Oh, you're on mute.
I forgot. Yeah, there was some noise going on in our yard. So there are multiple locations throughout the year that they offer when the training starts. And some people can, you can start it and not finish it for a year because you have things going on. It just really depends on how motivated an individual is to get through it. They have classes in Bremerton. They have classes, I know, like in Port Orchard, they have classes in Tacoma and over in the city in multiple locations. Bremerton's probably the closest location to us here. And so I split mine up. I did the first half was in Edmonds, and then I did like my last 2 days in Bremerton, just because that's how the schedule worked out. So it's kind of like taking a college courses where you can say, I'm going to take these first 2 here, maybe take 1 here, take 1 back there again. There's a schedule, and you just have to find, like, you have to do them in order, of course. And so you really have to just decide like when the times and days are best for you. A lot of the classes can last up to like 4 hours. Some of the classes I took I did a whole day of 8 hours, just to get through a couple of them. So it's really just up to the person that's going to become an IP, what their schedule allows them to do.
Are IPs paid for that training?
Yeah, so if you are not going to register through the state to do the work for someone that you know, then you do have to pay for your own training if that's what you're looking to do. But most people know that they have someone in mind, so they start that process together saying, okay, this is my neighbor, or this is my good friend or my relative, and they're going to train as an IP. So you start going through CDWA to say this person's going to start the training process. Of course, you have to fill out paperwork together, and then the individual starts their training. And then when they're done, there's more paperwork to sign at the end. You make an agreement with the person that's going to receive care that and then together you come up with a care plan and you come up with your own schedule, and then you're on your own together working out, future care.
So it doesn't matter if it's a family or neighbor, or if it's
doesn't
just
matter.
Someone you've seen on Carina.
Right. It doesn't matter. Anyone can become an IP. They just have to be 18 years or older, of course. And there's a whole list of other things that are pretty much most people are already, okay to start their training as an IP. Yeah.
And how are these situations monitored once they're set in place?
Well, that is through the individual mostly. I mean, once you have an IP that you are working with, that's up to you whether or not you can, at any time you can say, okay, this isn't working out, and you can end that relationship with that caregiver. If you're going the other end, which isn't available here in this county right now, is with the agency providers, and then you would have to contact the agency to let them know. So that works that way. But you would of course, if you had an individual provider, so when my sister-in-law needed more full-time care and I had to end my time working with her, I had to go and contact my caseworker through the 2 of us, where she was getting her hours through the state. And I had to let them know that I was ending my time working terminating, my care for my sister-in-law. And then she had to then sign up with a new individual provider that she found that would offer her the full-time hours she needed. So you do have to go through either the agencies or through CDWA in this case with an individual provider.
So that's really tough when somebody is not a good manager or self-manager. it leaves some holes in my view about care and observation of care needs.
Well, you do, so I will say this, a caseworker does have to check in a couple times a year with the person, with the individual receiving care and the care provider. So there are check-ins. It's not like that care provider just has no one looking over them. There are check-ins during the year to make sure that everything's going smoothly between both the care seeker and the care provider.
And so who does the check-ins?
That's going to be CDWA, Consumer Direct Washington.
One quick question that I have, or hopefully it's a quick question. So I know you mentioned that currently having the agency providers being able to access through Carina Care is only available in King County at this time. Is there anything that we can do as far as advocacy or bringing attention to this that could potentially open it up to, I mean, I will greedily say Kitsap County, but perhaps other areas as well? Is there anything sort of happening, or is it kind of a let's wait and see?
Well, that's a good question. I don't know if I could answer that, but maybe Chrisetta can.
So, you know, we are funded through King County to do this work. So, I mean, one thought is to see if your county would do something similar.
Kitsap, yeah.
Kitsap County would do something similar. I know that like our funder, our King County funder, really would love to find a way for this to be all over Washington. But you know, I would say start maybe at the county level. I mean, and if there's anyone that you wanted us to talk to and to give a demo of our site, we'd be happy to do that. You know, what the requirements are, how we work in King County, as Nadine said, is we work through agencies. You know, it's the agency provider model. So I assume that there are similar, and they have to be union affiliated agencies. So I'm not sure if that exists. If you have that gets up, you know, I think we would be able to have a conversation.
The foundation is there, and then you know, it just sounds like it's a matter of growing and obviously having conversations. So I mean, I feel like this is the beginning of a conversation, at least for us on our end. I know obviously this is the work that you're all doing, but I think you've brought up just some great ideas and some opportunity, and of course I would love to stay connected with you all. I know we have come to the end of our time, so I do want to be respectful of everyone's time here. But I know we have your information, so anybody who's either currently with us or watching this video, if you'd like any more information, please reach out to the Senior Community Center. Our number 206-842-1616. You can ask for Katie, and I'll be sure to either get you in touch with the folks at Carina or make sure that you have any information that you need that you may have missed from today.